Hi, so I'm going to be doing my week 3 reflection video. Um, my, yeah. So, first off, I'd like to say that it was really cool seeing some CSUN professors presenting. It was really encouraging, and I would also like to apologize for me not being super loud. My family is all asleep. I just got off of work. So, um, so I feel like this lesson and the example video really helped me not like necessarily learn about the ICF model, but really just kind of understand the ICF model more. We learned about it in our therapeutic exercise class, which was really great, but to actually be able to apply it to a patient and have a patient scenario and to have to go through the motions of getting the information and not just having the information readily available, I feel that that makes a big difference in how we apply patient care and how we see a patient for more than just an injury. So these videos really help me to see that we need to listen to all the information that a patient provides us, as small or as minuscule as it may seem, or as not as important as it may seem. It really is important. All these things are important because in the end you need all these factors in order to rehab a patient. So I know personally that for my mini encounter, I plan on just really honing in on more than just the injury and the return to play. I want to hone more into how does this injury affect your everyday life, your morale? How does this injury affect how you get to and from work? How are you able to work? Are you able to participate in different activities that you like to participate in? I'm going to be focusing on those things just as heavily as I would to return to play, because in the end, a person is more than just their injury. A person is more than just their contribution to a team or a program. And I think the ICF model really forces physicians to see that side. I think the ICF model also really forces physicians to see the impact as a whole on a patient's life. It doesn't just affect one aspect of your life. It doesn't affect just your sport. It affects your job, how you get to and from classes, different activities you want to participate in. So I think that's the ICF model does a great job, is just putting these into perspective for us as physicians and clinicians. So the barriers part, I'm being 100% completely honest. I have bias. We all have bias. That's human nature, is to have bias. Now, whether we let the bias dictate the quality of care that we're going to provide, that's different. I know that I'm a former college athlete. I played through a lot of injuries that I probably shouldn't have played through. I went to work with injuries that I probably shouldn't have gone to work with. But these are my own biases. These are my own, oh, if I was able to do it, then anyone else can. That's not true. Every person is different. Everyone goes through things differently. And as much as I was able to push through the physical pain, the mental pain and the emotional pain that it was taking on me was greater than the physical. I was able to overcome the physical, but not the mental and emotional. So I think we as physicians need to set aside our own personal bias when it comes to these injuries and the impairments and just the priorities that the patient has, and we just need to see it as, okay, we are doing this for the patient. We need to not let our biases come into play, but learn from our biases, learn from our own experiences to be able to provide them with advice, or let them know that they're not alone, that here are some alternatives that they can do from our own personal experience that we've seen, ways to handle, hey, I can't work, I got injured, this is how I handle it, and this is probably a way that you can try to handle it too. I think that our own personal experiences can help us, but we have to use our personal experience to help and to further educate, not to shame or basically tell an athlete or a patient that they can do it just because we were able to do it. It should not be a bias that dictates treatment or the course of treatment. It should be just information, supplemental information to help the athlete or the injured person. Because, like I said before, the ICF model forces us to see not just the injury, not just the patient, but the impact of this injury on the patient's life as a whole. Because in the end, yeah, soccer may be their sport, what they love to do, but it's not who they are. It's a part of who they are, a piece, but there's a lot more to a person and a patient than just their sport. So I really enjoyed watching week 3. It was nice seeing Dr. Rogers, and I feel like the ICF model, being able to actually apply it and not just having learned about it in class, class virtually, it was really nice. And I feel like this lesson will make me a better person and a better clinician, because I'm able to distinguish between my bias and my personal experiences, and really just see the patient as a patient with an injury that affects more than just their sport. So thank you guys.